right, this is ZiFM Stereo, my station, your station. And we were telling you the different days that we have in November.
Yes.
And we didn't tell you about World Pneumonia Day.
We did not.
We did not. Today is World Pneumonia Day. And of course, we've got DJ Joe with us here in studio too. Did I just say DJ Joe?
You said DJ Joe. You say DJ Joe.
I think I should take the new It's a promotion.
On those days.
We've got Dr. Joe with us here in studio because we want to talk about pneumonia. And each year on November the 12th, the world commemorates World Pneumonia Day to raise awareness about pneumonia, a preventable and treatable disease that still claims the lives of millions worldwide, especially among children under 5 and older adults. So the discussion we're going to have is going to focus on understanding pneumonia, recognizing its symptoms early, and exploring prevention strategies through vaccination, hygiene, and timely medical care. I mean, the goal is to remind communities that no one should die from a disease that we can prevent and treat. Dr. Joe, not DJ Joe. I mean, how could I do that to you? From a doctor to a
No,
DJ.
I actually like that.
You like it?
Yeah, the DJ
Nothing wrong with the DJ, though.
Cool,
Nothing wrong with the DJ. Just putting it out there.
Putting it out there.
But he's a doctor, not a DJ.
All right. So I want to talk about pneumonia, and I want to find out from you. First of all, what exactly is pneumonia? But also, is this a third world disease? Because I know in first world countries, I mean, there are certain diseases that they say these are still third world, like malaria. Who still has malaria in this day and age? They also say who gets typhoid in this day and age. So please explain to us: is this a third world disease, and what can we do so that we stop suffering from this?
All right, thank you so much, Queen Val, for having me and for bringing up this discussion. So before I get into pneumonia, let me address the third world thing. So pneumonia affects everyone, every part of the world, but more people die in third world countries of pneumonia than in first world countries.
What do you think that's the reason?
The reason being we don't get people vaccinated as much as the Western world does. Our children are not vaccinated as much as the Western world does. Our adults definitely are not vaccinated as much as the adults in the first world countries.
Okay.
That's the first main reason. Then the second reason, we seek treatment late.
Oh.
If a child has got a pneumonia, we think mamepo, we take them to ngangas, the pastors, and a lot of these other people before they come to the hospital.
Yes.
With pneumonia, time is very important. If you delay treatment, your chance of losing the baby are very, very high, because most of these pneumonia dates, they're okay to the under 5s and the over 65s. So time is very precious. So those are the main reasons why it affects the third world countries more than the first world countries.
All right.
Yes.
Well, thank you for explaining that. Are there different types of pneumonia, and what exactly causes it?
Yeah, so yes, pneumonia has got different types. We can classify it according to the type of infection. Number one, it could be a bacterial pneumonia, which is the commonest, and the commonest bacteria there is Streptococcus pneumoniae, strep pneumonia. And then it can be a viral pneumonia. Haemophilus influenza is one of the viruses that causes pneumonia, one of the commonest. Then it can be one of these atypical pneumonias or fungal pneumonias, which are also a bit rare. So those are the main classifications that we can also use classification according to where you got it. We call it community acquired, which is the commonest, like you get it in the community, which is the commonest pneumonia. Then there's also what is called nosocomial or hospital acquired pneumonia. If you get sick, you acquire the pneumonia in the hospital within 2 days of admission. After 2 days of admission, we call it hospital acquired pneumonia. And this one is more dangerous and kills more people compared to the community acquired pneumonia. Then you can also classify it according to extent of the way it's affecting your lungs. You know, your lungs has got about 3 lobes each lung. And by the way, some people might not even know what are the lungs and where they are.
Yes.
So to just clear the air, the lungs are found in the chest.
Clear the air. Did you hear what you did there?
You see what he just did? Yeah, clear the air.
So the lungs are in the chest. So they are the organs that we use for breathing. So you've got 2 lungs, one on the left and one on the right. So each lung has got about 3 lobes or 3 sections: upper lobe, middle lobe, and lower lobe. So if you understand that now, you understand what we call lobar pneumonia. So lobar pneumonia means it's affecting one lobe, which is the common one, and it's fairly easier to treat. Then when it's now multi-lobar pneumonia, it means it's got more than 2 lobes. Maybe you've got 2 lobes on one side, or one on this side, or one on that side. This one is now more difficult to treat. It mainly occurs in people who are immunocompromised, maybe HIV that is not treated, diabetes and things like that. Once you get those ones, now you know it's going to be difficult to treat. So essentially that's how we classify pneumonia.
I heard you correctly. You said hospital pneumonia kills more people.
Yes.
And it's the one that is gotten in hospitals.
Yes.
So imagine going to the hospital and then getting the most dangerous one at a place that you're supposed to be cured.
Yeah, it happens a lot. We say about 15% of hospital-acquired infections are actually nosocomial or pneumonias, or hospital-acquired pneumonias. And these ones, they are more deadly because the bacteria that you're getting has been exposed to some antibiotics. So it's now a bit more resistant. You see. So that's the main reason. So this one kills more than the community-acquired because it's already resistant.
All right. And which groups of people are most at risk of developing severe pneumonia?
So the most important group are the under fives. These ones, they develop pneumonia more than anyone else, and they also develop severe pneumonia, especially if it's coupled with the other underlying conditions. Like you're saying about third world countries, the other problem that we have is malnutrition. So we already have malnutrition that is happening, and now this child is malnourished and they get pneumonia. It's now difficult to treat because their immunity is weakened by the malnutrition. So under fives with malnutrition, pneumonia can take them with ease. Then the other group, over 65. If you're above 65, we also say we give pneumonia this nickname. That is the old man's friend. And the friendship is like, it's the one that will take this old man to the grave.
Oh, wow.
Will accompany you to the grave, yes.
Okay.
So if you're an old man has got pneumonia after 65, the chances of them dying from the pneumonia are higher than if it's a middle-aged someone.
Okay.
So the under fives and the over 65s. And the other last risk group, people are immunocompromised. The HIV that is not treated, diabetes, that is not well treated, and pregnancy as well. If you're pregnant, your immunity is down, chances of you suffering from pneumonia also
are quite high. All right, cool.
Yes.
If you want to be part of this conversation, please come through on 0772 168 045. We have Dr. Joe in the building, and we're here to talk about pneumonia. Maybe you do have some questions. Let's continue with this conversation. Let's talk about symptoms and diagnosis. Right? What are some of the most common symptoms that people should look out for, especially in children and the elderly?
So the first symptom that normally presents with someone with pneumonia, it's cough. So you've got a cough, and the cough with pneumonia usually it's short-term cough. Within a week or 3 days, you're having this cough, you present to the hospital. It's rare for someone to be at home for more than a week with a pneumonia. Normally, if your cough has been for 3 weeks, longer than a week, 2 weeks, we now think of other things like a TB. So it's usually an acute cough. That's one sign of a symptom of pneumonia. Then from the cough, you can get shortness of breath, because if you understand how pneumonia develops, then you understand the symptoms. So what happens with pneumonia, it's an infection, right, that happens in the lungs. And it affects mainly what are called the alveoli. The alveoli are the breathing units, the smaller units of the lungs, whereby gaseous exchange occurs. So in those units, there will be accumulation of fluid and eventually pass. So it blocks the movement of air. So when there's blockage of that movement, so when you're coughing, you're trying to cough out that pus or that fluid that is accumulating, get it. So when it's blocked now, oxygen is not getting into your body. Now you develop shortness of breath. You're panting for air because you're blocked inside. So that's shortness of breath. That's how you develop shortness of breath. Then the other symptoms can get chest pain on the affected lung. Then you can have what we call constitutional symptoms. Things like your fever, temperatures go up and down. Usually they spike at night. Then also headaches, generalized body malaise. Those are some of the symptoms that eventually develop because of a pneumonia.
All right. Before we continue with this conversation, particularly focusing on pneumonia, I'm going to take you out of it just a little bit. You see, I love it when you come on the show because this is our only chance to ask anything and everything.
I know.
Right. So 2 things. You mentioned about the lungs, right? Yes. I know of someone who operates with one lung. Is that possible?
Yes, it's quite possible. We as doctors can actually
functions.
Operates.
You got it.
Got it. Yeah.
So we as doctors can actually do an operation that is called a pneumonectomy.
Okay.
Pneumonectomy means we actually remove the whole lung. So, for example, someone had TB that damaged that lung severely, and this lung is not recovered fully. And when you're breathing, 50% of the oxygen that you're breathing in is going to the right lung, and 50% is going to the left lung, hypothetically. Okay. So, if this left lung is not functioning well, so that 50% is not going to be utilized fully. Maybe that lung is now functioning at less than 10%. Okay. So that means the 40% is being wasted. So it's better for us to remove that lung, then all the 100% goes to one lung. You function better that way. So you can actually operate with one lung, and you can actually get a lung transplant. It's quite possible. You can take someone's lung and to give you one lung. Maybe both your lungs are affected by certain conditions like cystic fibrosis. We can actually remove both your lungs, then give you an artificial lung.
All right.
Or a donated lung.
Interesting. Human body is very interesting. Well, the second question, you mentioned HIV, and right now the stats are being said that there's an increase in HIV cases, especially in young people.
Yes.
Yet we are done very well when it comes to HIV cases. As a doctor, what do you have to say about that?
I think people are now complacent. Now people know that people generally don't die of HIV. When we were young teenagers back then in the
Scared
early
of
2000s,
HIV.
HIV was scary. People
Yeah.
die of HIV with no friends. Actually, the classmate of mine from high school who died of HIV when we were actually in first year in college.
Yo.
Yeah, imagine when they maybe
sorry.
they contracted it during the vacation or something, but it was that bad. So nowadays, these children, they know that you can just take your ARV, so they are a bit reluctant. They don't condomize. They don't practice safe-sex behaviors, and yet we actually say, I always tell my friends this: for you to contract HIV now, yes, it can happen, but it's gross negligence on your part. There are a lot of
Okay.
things. Yes, if you already
Yeah.
have it, it's understandable, but contracting
There's
it
so
now,
many things. Yeah.
Now.
yeah, you can to begin with, you can abstain.
Yeah.
Secondly, you can use condoms. Thirdly, you can have post-exposure prophylaxis PEP.
Okay.
And
Okay.
lastly, you can be on PrEP.
Yeah,
and
as
the PrEP
well.
is now even injections that you can take. There's a 2-month injection and a 6-month injection that is coming up. So for you to contract HIV when there are all these
negligence.
things that are
Options.
available for you to protect yourself. So yes, young kids there, college kids,
College kids,
girls,
yeah.
boys, please make sure you practice safe sex behavior.
Thank you very much,
That,
Doc.
that is good. Now let's talk about prevention and vaccination. How effective are vaccines like the pneumococcal or influenza vaccine in preventing pneumonia?
Yes, vaccines are very important. The disparity that is there between the first world and the third world countries in terms of management and prevention of pneumonia comes down to vaccinations, availability of vaccinations and uptake of vaccinations. We started vaccinating our children of the pentavalent that also contains the Haemophilus influenza vaccine and also give them the pneumococcal vaccine. So these ones, they help in terms of minimizing your chances of contracting the virus for Haemophilus influenza and the bacteria for pneumococcal infection. So they are very important. If the children are vaccinated, the chances are, one, they will not suffer from the pneumonia. They might get it, but they might get the bacteria but not suffer from it. Two, if they get the bacteria, they suffer from it, they might not get severe symptoms, and their chance of dying lastly are very low. So we need to encourage everyone. If you've got your child who's under 5 who hasn't been vaccinated, please make sure they go and get vaccinated. It's good for a child. Like I said, a lot of children die because of pneumonias. We say about 15% of under 5 deaths are attributed to pneumonia.
Wow.
So 15% is a lot, and these are preventable by vaccination. So if we vaccinate our children against these, chances are they'll survive. Even the elderly, even you and me who are still in our middle ages, getting the pneumococcal vaccine will actually help you not to suffer from the pneumonia later on.
All right.
Yes.
And Doc, there's the common cold, flu,
Yes.
and then there's bronchitis.
Yes.
There's also COVID.
Yes.
So how are you able to differentiate and know that this is pneumonia?
All right. Thank you so much for bringing that up. So the common cold essentially affects the upper respiratory tract. We call it an upper respiratory tract infection. The influenza, it really goes to the lungs. Yes, some of these bacteria, the strep also affects the upper respiratory tract, but it can also go to the lungs. It's one of the commonest causes.
Okay.
So eventually for us to make a final diagnosis, because the symptoms could be similar, could have cough, but it's rare for you to have shortness of breath with an upper respiratory tract infection.
Okay.
And also the pneumonia, you really have a sore throat compared to someone who's got an upper respiratory tract infection, the influenza. And running nose, blocked nose, you don't get those symptoms with a pneumonia. And also it's rare to get a chest pain with a upper respiratory tract infection unless if you've been coughing excessively.
Okay.
Then lastly, we do a chest x-ray.
Okay.
A chest x-ray is one of the gold standard of diagnosing a pneumonia. So when you do a chest x-ray, you can see the lobe that is affected. You can see that the lung has got consolidation. Then that way you can be 100% sure. Even on examination, you can examine the chest, a percussion and auscultation, listening with the stethoscope. You can listen in the chest and you can tell that this part of the lung has got pneumonia. So by examining from the history, from examining the patient, then eventually investigations, things like chest x-ray, rarely do we need to do a CT scan for a pneumonia, but a chest x-ray is usually enough for us to make a diagnosis, and then you can tell that this is a pneumonia. But COVID can give you symptoms that are also
Yes.
similar,
Yeah.
and can also give you consolidation in the lungs.
Yes.
It's quite possible. So at times, eventually, we also go to the laboratory tests for COVID. Remember, we used to do
Yes.
the nasal swab.
That was
and
the
also,
worst.
Yeah, I know. People never used to like it.
Yeah.
And also blood tests,
Yes.
cultures to check for these pneumonias, or throat swabs. They can also help us to eventually make the final diagnosis.
So, besides vaccination, Doc, what lifestyle or hygiene measures can reduce the risk of infection.
Yeah, just like we were doing with COVID, we need to protect ourselves and our children. So number one, basic hygiene, washing of hands. So at times you might think that the bacteria is always in the air. At times someone coughs and the bacteria is on surfaces and the children are touching these surfaces. Then they wipe their nose or their mouth and they contract the bacteria. So make sure your children wash their hands. Surfaces are always clean. The house is clean, less house mites and things like that. It generally minimizes chances of children suffering from pneumonias. If someone has got a cough, let's just assume they're West. Make sure they always isolate themselves. They also always teach your children at a young age to cover their mouth and their coughing, especially the inner part of their elbow. That way, the bacteria is not going, or the virus is not going to be spread everywhere else. So hygiene plays a very important role. And then immunity also plays an important role. So make sure our children, they drink plenty of water so that they're all hydrated. They exercise. It's good for children to be exercising so the immunity is good. Eat plenty of fruits, plenty of vegetables. All those things are also going to help eventually when the pneumonia comes.
Very interesting. So we're talking about vaccination and all of that. I want to ask about Zimbabwe or Africa because we spoke about third world countries, right? What public health steps can help reduce these pneumonia-related deaths?
So number one, to minimize the deaths, like I said, most of these deaths are also coupled to other underlying conditions. To minimize deaths, let's manage things like malnutrition. Malnutrition can be managed very cheaply and affordably. People believe that malnutrition is a condition of poverty. It's not necessarily true. It's a condition of ignorance. Children suffer from malnutrition not because their parents are poor or not because they come from poor backgrounds. We get more malnutrition cases here in urban centers than in rural areas.
Oh.
Yes.
Okay.
Most patients that come with malnutrition, they are from urban areas. So it's mainly because of ignorance. These are the children that are being given freezits, mazepe, and things like that on a daily basis.
It's not a balanced diet.
It's not a balanced diet.
Right.
Children in Kumusha are eating a lot of dovi, peanut butter, peanuts, milk, goat milk, cow milk. They don't suffer from malnutrition. You get it. But our children here in urban areas, we are busy giving them mazepe, masowe, and all these things. And those things are not healthy. So instead of focusing your money on buying these useless things, buy your beans. A bucket of beans should be affordable.
Yes.
You can buy peanut butter. Peanut butter is fairly affordable. Porridge has to have some peanut butter in it. If you don't have money for meat, because the malnutrition is mainly protein energy malnutrition. That means there's lack of proteins. So if you have peanut butter, if you've got beans, if you've got matemba, milk, these things are fairly affordable. You get it? Instead of buying freezits, buy a 1 liter of milk. Instead of buying mazepe, buy a jar of peanut butter. So if you do those things, then once the immunity is stable, they don't have malnutrition. Even if when they get the pneumonia and they're also vaccinated, chances are they will not suffer that much from the pneumonia. They might not even need hospitalization because pneumonia is a broad spectrum. You get some people with pneumonia that don't even need medication. It's rare though. Then you get some people with pneumonia that might need to just take medication at home, then they'll recover. Then a few people will need to be admitted, and then very few will need to go to ICU. So people actually go to ICU because of pneumonias. Yes. So if we manage in terms of reducing malnutrition, your immunity is stable, and then we'll give you vaccinations. We minimize the chance of contracting by making sure that people don't spread. Hygiene is improved at home. Your children are highly unlikely not to suffer from pneumonias. So all these measures, they play a role in terms of minimizing the chance of children suffering from pneumonias.
Doc, thank you so much for the time that you've had with us. But before you go, what are your parting words to everybody that is listening right now on a day that we are I don't want to say celebrate because I don't want to celebrate the disease, but it's a day we are recognizing, commemorating.
So but the most important thing, number one, vaccinations, they are very important. So if your child is not vaccinated, you've got an under 5 who's not vaccinated, please make sure they go and get vaccinated. There are a lot of myths and negativity around vaccines, especially that came with the COVID vaccine and all that. Please, the vaccines are very safe and your children are safer with the vaccines. They will live longer and a healthier life with vaccines. So please make sure they get vaccinated. Secondly, make sure your children eat healthy, plenty of high protein foods, be peanut butter, milk, eggs. These are things that are fairly affordable that you can buy your children instead of freezits, mazepe, and all these things which our children like. Teach them to eat healthy things. These things are going to protect them in terms of building their immunity and then minimizing the chance of contracting these bacteria and viruses that cause pneumonia. So eventually they'll be healthier and live longer.
And I guess for adults as well, because we shouldn't assume that adults understand a balanced diet.
Definitely, yes.
All right.
Doc,
Well-
thank you for your time.
Anytime.
Hopefully we get to link up again and talk about, because I feel like there's a lot to talk about.
There is a lot.
He has some gems to drop to people and the listeners as well. So we really appreciate the time that you had with us.
Anytime. Prayer is always mine. Thank you for having me.
You're welcome, Doc.
Sure.